Do you have any questions at this point, or anything you want to ask me specifically? Yeah.
Again, I need to know, how do you find qualified practitioners
Okay.
that are up to date on treating trichotillomania?
Several ways. One is, first and foremost, you need to know what questions to ask people. On my website, there's a button that you click on that will tell you, how to find a practitioner. Like, what questions do you ask when you call, whether it's a physician or a therapist, okay? So it tells you, and it'll even tell you what answers you should expect from them and what the danger signs are, things that they may say or do to beware of if they say or do them, to sort of stay away from these people. Because right away, if they answer in a certain way, as I've indicated in this thing, if they're cagey or they hedge around or they act like they know what they're talking about, it's pretty clear that they don't stay away from these people, But if there's an article right on there, it'll tell you what to do exactly. Secondly, you can contact TLC. They have a referral list. You can always call them. Again, they don't vouch personally for people on the referral list. If you can see somebody who's listed on the Science Advisory Board, though, those people, and I'm one of them, so I guess I can say that. But the SAB people are generally people who are kind of, pretty well known in this field, and we know what we're doing with this. So you probably can't go wrong there. Or people who work with SAB people, who work for them or with them, you can be sure that they're good quality people, because I know these folks. I've known them for years. They wouldn't have anybody working for them who didn't know their stuff. You can also check the website of it's the Association for Cognitive and Behavioral Therapy, and their website is, they changed their name so the website doesn't exactly, it's abct.org. No, I'm sorry, AABT.org. That was the old name. They never changed it. It's now, the organization is now called ABCT, but the website is AABT.org. They have people listed by specialties. AABT.org. They have people listed by specialties. They do not list body-focused behaviors, but they do have people who are listed under obsessive compulsive disorder. And very often, you'll find that people who specialize in OCD sometimes will also specialize in body-focused behaviors, because they sort of are a natural fit, basically. A lot of people do both. So you can make some phone calls, and they have it broken down by state and town. So you may find people in the area, you may find the OCD specialists who will either do this or may know somebody who does it. So that's another good source of information. Yeah?
One thing I was hoping when I got to this is the correlation between food and OCD or TREC. In other words, like, there are new studies made, you should stay away from these foods. Obviously caffeine, but more than that.
Not really. Nobody's ever really identified any particular food that seemed to be an input. Years ago there was a whole to-do about certain foods and artificial ingredients and sugar aggravating ADHD, but then they did some double-blind studies on it. It was something called the Feingold diet and some other things, and they found that there was no validity to those things, that they, despite of all this talk and books written on this subject and lectures and all these people devoted to this stuff, didn't hold water at all. And it's never been shown with these disorders either, quite frankly. So I doubt it. Caffeine or any stimulants or things that contain stimulants, like Excedrin, a lot of caffeine in it, or stuff like that, are likely to do that. Some people, when they drink alcohol or other things like that, may also be more likely to do these things because they have a disinhibiting effect. But other than that, there's really nothing I know. I mean, if somebody finds a particular thing that really does seem to have a connection for them, fine, but there's no thing that's sort of universal that seems to apply to everybody that I could recommend to you. Yeah?
Well, you were talking much earlier about there's a spectrum from those who are understimulated to overstimulated.
Yeah.
And those who are understimulated may be looking for stimulation.
Right.
Okay, so an internal stimulant like caffeine would not work. It would have to be a surface stimulant.
Well, no, caffeine can make you overstimulated. It causes the release of glycogen from your liver. It gets you alert. It gets you like really hyped up, basically. So, some people I've actually seen people reduce their behaviors when they got caffeine out of their diet. Some people actually suffer from what's called hypercaffeination. It's kind of like we call it Starbucks syndrome or something.
I was actually wondering the opposite. Would a little caffeine help the person who's understimulated?
Never tried it. I don't know, and I don't know what the levels would be. But I guess if somebody pulled when they were tired, they could. I tend to steer people away from, you regulating yourself via those things anyway. I don't think there's any nutritional need for it. It's better to probably just stay away from it. I never was any the worse for. In fact, I felt less tired when I gave her caffeine because it used to keep me up and keep me from getting the sleep I needed to
Yeah.
alleviate the real tiredness, for which I would just drink more coffee. So it's probably self-defeating to get involved in that cycle in the first place.
Right.
Yeah, in the back.
I've been seeing a therapist for a while. He's not related at all to any type of disorders like this. He's just a typical therapist, I guess you could say, more for anxiety,
Right.
more than for trick. Then I just, on the TLC website, located a specialist really close to my area, so I made an appointment. I'm going to see her in a couple of weeks.
Well, good.
Her opinion was, you know what, you don't really necessarily need to stop seeing the other therapist, but what's your opinion on seeing two different people at the same time?
Well, as long as they're not giving conflicting information or conflicting instructions, it's okay. I mean, obviously it's better if you can concentrate your efforts with one person. Number one, it's going to be a lot less expensive and time-consuming. So it would be better if you can get, like one-stop shopping is obviously a lot better than, going to several different people. But, it's up to the person. If somebody has a relationship they've established with somebody and they find that it's really helping them and it's really doing them good, I would never tell someone, don't see that person. I leave that up to the person themselves, really. The only time I'll step in and say something is if the person that they're seeing is like trying to undermine what I'm doing or is trying to steer them away or discourage them from getting legitimate help or trying to make them dependent on them in some not very good way, then I will recommend that they ditch this person.
I have felt a little bit, just a slight resistance to, well, you're not going to need to go see someone else, or, well, we'll kind of get to that. Not that he's totally skirting it, it's just, I'm kind of like, no, help me now with the habit, and he's more like, let's find out why you have anxiety, and
See, but that's,
So that caused me a little bit of concern.
That worries me a little bit when I hear people. It is like they'll always say, oh, well, we'll get this other thing under control, and then we'll come back to this, but they never really do because they're not comfortable with it, they don't know what they're doing, and they don't want to, be set up to do something that they don't know how to do. Rather than just saying, look, I'm not that kind of specialist. I get calls from people who say, oh, I've got this problem or that problem. I say, well, that's not what I do. You wouldn't do well with me. Go see somebody else, and I have no problems in making referrals to other specialists because I know a lot of other specialists. But, I think we should know what our limitations are, and I think there's some people out there who are somewhat less than ethical, and I'm not talking about your person in particular, but there's some people who are not very ethical. They will just try to keep patients because they want the income, quite frankly, not because they can really help them or not, and that's a very bad thing and a very unethical thing to do, and I'm totally against that, so.
Thank you.
Yeah.
That happened to us, because he didn't want to admit that he didn't know what it was, and so he acted like he knew what it was, but his advice to our daughter was, just tell her to stop doing it. And so we immediately left him, and called another therapist, and he said, no, I'm sorry, but I don't know anything about it.
Well, that's an honest person.
Yeah, and so you have to be really careful.
No, you
And I
really-
found another one who said, I've treated adults, I'm willing to take your daughter on, can you give me everything you've gotten from TLC, I'll read it all,
Okay,
and we'll try.
that's reasonable, that's
Actually
reasonable.
helped us.
You have to, if the questions you got to ask are, have you had specific training in treating this disorder? Or did you get supervision from, somebody who knew what they were doing? How many cases have you treated? This kind of stuff. What methods do you use? These are the kind of questions people don't ask. People put more research, like to buying a dishwasher sometimes than buying therapy. So I think you have to be very careful about that. But ask questions. You are a consumer. It's your money. It's your health. You have every right to ask. And if a person gets cagey about answering these questions and gets defensive, then you got the wrong person. Anybody who's worth their salt should be open and honest and able to answer any question you ask. Yeah.
Yes, is there any help or information available for a preschool-aged child that lives here?
Actually, a good person to talk to is two good people are here actually at this meeting, Ruth Gollum and Sherry Bavrachek. They did, Ruth, I think, had written an article about preschoolers for TLC. I don't claim to be an expert in kids that young. I treat kids generally about 7 or 8 and older for the most part, but the very, very young. I'm willing to, if there's nobody else who can do it, I'm willing to work with parents on it, but I don't think that I am the most expert person on that particular area.
I have a 3-year-old who has trick, and
Yeah.
after his 3rd or 4th bald spot, my husband insists on shaving his head. And you had said earlier that it's hardwired not to mess with that.
Well,
Is that a bad thing to
if
do?
somebody that young, maybe you could. I would even try very small doses of inositol.
Okay.
My son went on inositol when he was 3, as I had mentioned, for his nail biting, and it seemed to help him.
Okay.
And he had no ill effects. I would try in very tiny doses, though, so it would really minuscule, work your way up very gradually. It might help him. I
But
don't
you
know.
don't think that's going to cause him distress to take that away from him?
I don't know. For some kids, it's sort of like a phase they go through. It's really not much more than thumb sucking, and they will probably develop out of it. We call it baby trick. basically, like toddlers and young children who have, it seems to come and it lasts for about 6 months or so, and then they kind of develop out of it, but if it
He's had
doesn't seem
since
to
he's
be...
born. He's been doing it since he
Okay, then maybe you are dealing with trick, and it can start in the very young, and it's probably, you know, which makes a pretty good case of how biological it is, really, when you see it in someone that young. I've heard of cases as young as 18 months. I've had calls from people. But you could try some stuff like that with a child. See, I don't know. See, also redirecting him and giving him other things to do with his hands, toys, textured objects, things like that. And also watching him yourself and learning what his hot spots are, basically, and what activities you can try to restructure his day and reorganize him so he doesn't do that stuff constantly. So that might help also. That'd be about the best information I could give you, I think. Other questions? Yeah?
Just briefly, is there any correlation that you guys have found between trick and eating disorders or compulsive eating or anything?
I've never seen any particular connections between them. I mean, there are people who eat hairs, but that's about as close as one might come to that. But that's really, again, more of a sensory thing.
But isn't it all the same part of the brain, the compulsive behavior?
These things actually involve a lot of different systems of the brain. Some of the areas in trick are different from those that you might see in OCD or certain other kinds of disorders. So not necessarily. We have a lot more to learn about this, I believe. So, okay, I guess we're going to about finish now, and thank you for coming.